Pharmacist Interventions Part 6. This one was recent. I had a patient prescribed a blood thinner. It's called Lovenox, enoxaparin. She was about to have surgery, and they were gonna give it to her prophylactically, meaning they gave it to her to start taking after the surgery to prevent a clot, because this was a high-risk surgery. It flagged that she had an allergy to pork. Usually when it flags like that, it's usually a religious intolerance. So I asked her, do you eat pork? And she said no, and I told her that heparin and heparin products like Lovenox are porcine derived, meaning they come from porcine. So she did not want to pick up the anticoagulant at all. And I told her that there are a lot of other alternatives for her, albeit expensive. I understood where she was coming from, and I recommended Eliquis. A few days later, I got a call from her office, and they didn't know what was going on. They asked me what was up with the enoxaparin. And I said, well, she doesn't eat pork. Enoxaparin and Lovenox are porcine derived. And they asked me what I recommended, and I said I recommended Eliquis. And then they asked me what dose to give their patient. Usually they would know that. It was a weird question. But I said, okay, well, it's 2.5 milligrams twice a day for preventative measures. It's usually about 2 weeks up to a month, depending on the severity of the surgery as well as the risk of clot for the patient. So it was an interesting little interaction. Another one was I've had a patient on hormonal replacement therapy for menopause. She's taking an estrogen. It's usually routine for me to ask, sorry, my phone overheated outside. But it's routine for me to ask patients on hormonal replacement therapy, just estrogens, if they have an intact uterus. It's a weird question, but most patients usually say no. I've had a hysterectomy, and then I go on and with the transaction. But this patient in particular said, well, yeah. And I told them that they needed to be on a progestogen. Patients who are on hormonal replacement therapy need a combined estrogen and a progestogen, because if you're on just an estrogen for that and you do have a uterus, it's a risk for endometrial hyperplasia, which is a risk for endometrial cancer. So I told her that, and she's going to talk to her doctor about it. I've had a patient who is taking Lipitor and colchicine. Lipitor is a statin, it's for cholesterol, but it interacts with colchicine. Colchicine is as needed for gout. The colchicine increases the level of the Lipitor. Depending on how much you take in your dose of Lipitor, it can increase the risk for rhabdomyolysis, which is when your muscle breaks down and causes kidney failure.